He's the CEO and Chairman of Augma Biomaterials. His presentation today is titled Bone Graft Cement from Evolution to Revolution. His presentation will explore the potential and new opportunities of using cement-based augmentation materials in the maxillofacial and dental fields, and emphasizing the advantages, disadvantages, and methods of use for the scientific and clinical points of view. Welcome, Dr. Yahav.
Thank you very much. First, I would like to thank the organizing committee for inviting me here. It's a great pleasure, privilege, and honor to be here. And of course, I would like to thank you all for sharing your time with me in this late afternoon. Today, I would like to speak about advanced augmentation solutions by using bone graft cement. Simplicity is the ultimate sophistication. Statement made by Leonardo da Vinci a few hundred years ago. It was right then, and it was right now. How many of you would imagine themselves lighting a fire in that way when you have a matches in your hand? Probably, the future in our field, very few of you will imagine yourself working with granules and membrane when you will have cement in your hand. So the question is, why cement? Cement actually changed all of the construction field since they have been founded. It changed the orthopedic field, and now it's our turn. Bone cement, suitable bone cement for our field as well. Actually, up until now, we are working with granules, patties, in order to improve the handlings. Those patties can be those that we can purchase, or those that we can make by ourselves. And of course, blocks, which are completely different techniques. So we are all familiar with those techniques. If we work with blocks, we need to shape them, to stabilize them. It needs some experience. If we work with granules, the same. We need to stabilize them in place to prevent their movement. Normally, we need to use membranes, which is additional cost for us. And fairly, we can have some volumetrics results. Now, the question is, are we going to have regeneration or repair? Are we going to speak about true bone regeneration, or are we going to have, in the end of the day, some kind of repair? But mostly, the grafted site will be occupied by our graft, and not necessarily by the bone. So if we're looking at this core, this is a core which was taken from material that does not resorb. 80% of the core is a non-vital bone. If we will look about material that is replaced completely in the patient on bone, we are talking about 100% regeneration. But we need to understand, it's not enough that it will resorb, because when it resorb, it can be also connective tissue, not necessarily bone. It has some It need to have some ability to induce the bone to be formed in that area, and then we might have 100% regeneration. Now, when we use a material that resorbs simultaneously with the bone formation, actually is a short-term space maintainer. And we know that if we want to have success in augmentation, there are two essential requirements. One is space maintaining. The second is graft stability. No matter what kind of graft we are going to use, if we will not respect those two essential requirements, we will not have bone in that area. So, if we are using something that replaces even simultaneously with the patient on bone, it's a short-term space maintainer. Therefore, sometimes we need to create a composite graft. A composite graft can be a mixture of two different augmentation material, which can be a mixture of autogenous bone graft with xenograft, or any other augmentation material with different behavior, in order to gain a little bit more vital bone in the area. So in the end of the day, we will have much better result than this one. So when we work with granules that are not resorbed, actually the bone that can be formed is just in between those tiny spaces that exist between the granules. Therefore, we are always being taught not to condense our granules, because probably if we do so, we will not have bone. After even 6 months, we're going to find some granules that were not integrated. Now, if the graft is in a good quality, we will speak about integration. Integration? Where is the regeneration? And by the way, no matter if you use allograft, no matter if you use xenograft, the only regeneration that you might have is maybe if you use autograft. But integration, it already shows us that there is no regeneration. There is a small regeneration in between those particles that were integrated. And if the graft is in a good quality, we might speak about functional continuity between the graft and the bone, and then definitely we can have some good volumetric result. We can have something that will work. We need to wait normally about 6 months, 5 months, until we have a solid mass that we can place or load our implants. So always there will be those who will say, why should I care as long as it works? And true, it works. But I think it's the same as for those who will say, why should I care as long as I sleep? Because definitely you can choose to sleep in that way, or in this hotel, or in this hotel. Everything is a matter of standard that you define, that you want for yourself. So let me summarize what are the existing drawbacks of the grafts that we have today. And please, if somebody thinks that I'm wrong, please raise your hand. They are difficult to stabilize and to work with. Therefore, they prolong our chair time. In the end, we have a limited amount of vital bone. Therefore, it's prolonged the healing period. Membrane coverage is essential. Therefore, it's increased our costs. So as my uncle say, bone cement is a different concept. But as a different concept, it can give us a different possibility, but we need to understand the concept before we start working with it, because it's completely different than what we've been used to work with up until now. So let me show you a video that was made by Professor Ziv Mazor. I'm sure that some of you are familiar with him. Here we did one part with cement. Near it, we use granules. So first you activate the cement. The only thing that you need to do is to eject it into the side. It sticks to the area. You press it for 3 seconds, not more than this, and you're done. No need for membrane. If you want to add, you can always add. And if you add, again, press it again for 3 seconds and close your flap. Now, if we work with granules, first thing that we need to do is to take a barrier membrane. We need to mix our granules with something in order to improve their handling. And I think everybody can see the difference. A video is better than 1,000 words. Now the question is, what will be the results? And definitely we shorten the video because probably it would stay much few minutes. Now, of course, we need to close it, primary closure, tension-free, which is very important when we work with membranes. 3 months post-op. That's how it looks before, the cement area, and this is the granules area. And this is the bone. And this is the granules area. You can see the efficiency of the bone due to the granules movement. So, about 20 and something years ago, I wanted to make it differently. I wanted to find something that will change our world of augmentation procedure. So I knew that cement might be the solution,